the worst questions to ask a general pediatrician about autism. If you are thinking about asking your general pediatrician about autism, hold up, because today I'm going to share with you the worst questions to ask them and what to ask instead if you want answers that actually help your child. Hi, I'm Dr. Theresa Lyons. I'm a Yale University trained scientist and autism parent, and I teach parents like you the cutting edge science of autism so that you can make the best decisions for your child based on quality information. First question, why isn't my child speaking? That's a big question, but here's the thing. Speech delay is a clue, not a diagnosis. And many times a general pediatrician, they're not even going to know the answer. So they might just tell you, well, they'll grow out of it and every child develops differently. And usually when parents hear that, their intuition tells them, I know something is wrong. Don't let this go. Pursue this. So what to ask instead? You could ask, what specialist can help evaluate my child's communication and underlying neurology? That will definitely get you a referral to someone who hopefully has a bit of a chance of answering that question correctly. Number 2, why won't my child make eye contact? It's definitely a very important question. And when you ask that, there might be some awkward silence. Just like that. Because eye contact, it's nuanced, right? So it can be cultural, it can be developmental, sometimes personality. So if your pediatrician gives you a one-size-fits-all answer, again, that's a red flag. So a better question would be, can you refer us to someone who's trained in social communication development? Now that might get you someone who's a bit more like speech therapy, but it's going to get you pointed in that right direction, focusing on social communication. And ask that question, it won't necessarily just get you a referral to a neurologist. You really want to understand the social aspect. And there are experts for each of these areas. 3, why doesn't my child respond to their name? Yes, that is a classic red flag, but again, it's not always autism. It could be hearing, it could be processing, attention. Unfortunately, your pediatrician might just say, let's wait and see, right? And many times that's code for, I don't know. So ask instead, can we get a full developmental and auditory evaluation? Confused by all the information about autism? I've got you. Click the link below to see how we can work together. Let me break down the science and provide you with clear, actionable steps to make your path forward easier. All right, question number 4. Can we screen for autism? Yes! The earlier you screen for autism, the earlier you ask these questions, the earlier you get in front of different specialists, the better. So yes, you can screen for autism. However, most pediatricians are just going to use some super basic tools that do miss a lot. So you can ask for a screening, but remember, general pediatricians do not give autism diagnosis. Why is that? Because they don't have proper training to give a diagnosis. And so that's why it can get frustrating to want to ask them questions about autism, but they're not experts in that. So what to ask instead? Can we do a more comprehensive screening, or can we get a referral to a developmental pediatrician? Question number 5. What therapies do you recommend for my child? Many times this is after a parent has gotten a diagnosis. And you might get this vague list of speech, OT, ABA, right? Okay, yeah, you could have gotten that information on Google. But the real question is, what does your child need based on science and their symptoms? So a better question to ask would be, can we build a therapy plan based on individual assessments and not just standard referrals? Right? That gets the conversation going, specific to your child. Number 6, why does my child engage in repetitive behaviors? So things like lining up toys, watching the same 5 seconds of video over and over again, maybe saying green truck 80 times. You'll hear, it's just a phase, potentially. Stimming can be a coping tool, so you might hear something along those lines. But those are really basic answers, and they're not getting you into the root issue, which is what you want, because I'm sure your child does not want to be caught in a repetitive loop either. So a better question would be, what could these behaviors be communicating? And who can help decode them? That's where you want to get at. 7, will my child outgrow autism? Now, this one is a loaded question. You're probably going to get lots of different answers, but know the science. This is where knowing the science is really important. So yes, some kids lose their diagnosis. In the literature, it's called optimal outcome. But it's not about outgrowing. You outgrow pants, you outgrow shoes, you outgrow jackets. You don't outgrow autism. So if you're interested in learning more about how children lose their diagnosis, meaning they regain their health and they're in school without additional supports and they don't need therapies or anything like that, it's possible, but you've got to get in front of the right people. So a question to ask instead are, what are the outcomes for children who receive early personalized intervention? That is a great question, because that will tell you how knowledgeable the person is in front of you and whether or not you should take their advice. The answer, in case you're wondering, is the latest research showed 37% of kids with autism lose their diagnosis, meaning they no longer need any additional supports or therapies. So if that's not the answer you hear, you're not talking to an informed doctor. It's plain and simple. Number 8, how do we know if my child has parasites? Now you're starting to get into the territory where a pediatrician is like, whoa, they might raise the eyebrows, they might look at you like you're crazy, they might kind of try and get you out of the office real quick, right? So what to do instead? Seek out practitioners that are trained in integrative or functional medicine. So parasites, it's not really a general pediatrician's wheelhouse. Maybe pinworms, that goes around a lot in kind of kindergarten, but there's so much more than just pinworms. So make sure you ask that question to a knowledgeable doctor. Number 9, can you prescribe leucovorin? Asking this might be like ordering sushi at a pizza place, right? So some pediatricians will be like, wait, what? What's that? Or they might say, that's not FDA approved for autism. And they're not wrong, but they're also not helpful. They're also not informed. They're not up to date with the cutting edge research. So ask instead, can you refer us to someone familiar with folate metabolism and autism? That will get you pointed in the right direction. Look, your pediatrician is awesome for colds and growth charts, UTIs, ear infections. But when it comes to autism, you need a specialist, and many times more than one. And you want to ask the right questions to get the real answers. Parenting a child with autism is about asking the next level questions. You can do it. I'm here to help you. See you later.